to start? Water birth and NHS. Prior to entry, short safety assessment to ensure laboring mother safely can get herself in and out of pool. Means before water birth, we always ensure with laboring mother by providing her short safety assessment. That is to ensure that she can herself in and out of pool. This is very important, that you will be provided some short safety assessment so you can yourself get in and out of pool. That is very important. It means that mother should be capable enough to come out of herself as well. So what all short safety assessment that we will ensure her, we will tell her about that. So that is going to be, when you talk about water birth to mother or laboring mother or the women who has come to discuss about the delivery option, when she will talk about water birth, please tell me, doctor, about water birth. So this is how you are going to start. That will ensure before entry, will ensure or will guide you about short safety assessment to ensure that you can get in and out of pool yourself. Second, making aware of circumstances when midwife may request laboring mother to leave pool. Second, we would say that we will let you know about the certain circumstances where you may need to leave pool immediately. It is suggested to follow guidance of midwife and making efforts to comply with requests to exit the pool. We'll discuss with laboring mother that it would be suggested that when midwife would decide to come out, it is suggested to comply with the request to exit the pool. So this is how you are going to start. Short safety assessment will ensure that will make her aware of the circumstances when she need to leave the pool, and she has to follow the guidance of midwife and making effort to comply with request to exit the pool. Means she cannot say, no, I won't come out. You have to do my delivery here in labor ward, in water, in pool. This is a kind of part which laboring mother and midwife has between them. That whenever midwife would ask her to come out, she has to come out. So you start with that. Okay, I'll let you know about how we go about the water birth or how we handle water birth. We'll give you some short safety assessment before you enter the pool. So you will be able to get out or get in a pool yourself. There are circumstances where you have to get out of your leave pool immediately, and you are supposed to, or it is suggested to follow the guidance of midwife and making efforts to comply with the request to exit the pool. Means she cannot be stubborn here. If midwife is guiding, she should leave the pool immediately. Third, home water birth allowed. Very common question. Whether home water birth in labor ward prioritization, if patient is asking for water birth, whether we should keep it as routine, semi-urgent or urgent. When water birth is allowed even at home, so definitely it can be a simple routine case, because at home you cannot do the semi-urgent or urgent cases. When it is semi-urgent or urgent, it has to be in the hospital. So it is not necessarily that if it is a water birth, it is going to be a semi-urgent case, because if they allow home water birth, it means home water birth water birth delivery can be a routine case if it is given in labor ward prioritization, depending upon rest of the situation or condition. If she's VBAC, if she has some medical condition, if she has a high BP, in that case, it is not going to be a routine case. But not to enter birth pool until community midwife arrives, as water may accelerate the labor. Now, this is how you are going to explain that. Until community midwife would be there, she is not allowed to enter the pool. And it's too early to enter the pool before regular contractions. So first, home water birth is allowed. Second, one should not enter until community midwife is there. Third, one should not enter very early. It means it's just pre-labor or just one contraction in 10 minutes. There is hardly 1 or 2 centimeter cervical dilatation. No. What is the ideal time to enter in the pool? When labor is established, that is cervical dilatation has to be 4 to 5 centimeter. So this is the time when she should enter in the pool. Am I clear, girls? Am I clear, girls?
Yes, ma'am.
Okay. Yeah. So home water birth is allowed. One should not enter until community midwife is there. One should not enter in the pool before regular contraction. Or you can say that Sarah, it is suggested to enter one water pool when you are in established labor. Means when you are getting contraction 2 in 10 minutes and the mouth of the womb is dilated almost 4 to 5 centimeter. Next. Midwifery care, definitely water births is not something that it will be on your own. Midwifery care has to be there. Midwife has to be there for emotional support and the encouragement, and definitely physical support and conducting delivery, that is definitely there. But for emotional support and the encouragement, baby heart monitoring every 15 minutes. Second stage of labor, more frequent monitoring, as we normally do that in second stage of labor, we do 5 minutes. So it is approximately 5 minutes. So midwifery care, baby heart monitoring every 15 minutes. Second stage of labor, more frequent, that is 5 minutes. Vital checking regularly, that is temperature 1 hourly and pulse 30 minutes. Monitor, this is very important point, because I think one of the examiner or one of role player asked this question to one of the candidate. Monitor and maintain the temperature for mother comfort and to minimize, sorry, it's minimize risk of baby. So we will check it hourly, means pool's temperature and mother's temperature, both we check hourly. And that is a very important safety point, a buzzword and a question either examiner or role player is going to ask. Monitor and maintain the temperature of water for mother's comfort. Mother has to be comfort with the temperature and minimize the risk of the baby. So checking hourly. So just remember mother's temperature and pool's temperature, both we check hourly. And now there is one more very important question. One of the candidate asked in this exam, what should be the ideal temperature? First, it should not go above 37.5 degrees Celsius, and ideally try to maintain between 37 to 37.5. Clear? So there are many buzzwords: midwifery care for emotional support, encouragement, checking hourly, pool's temperature, 37 to 37.5. We should maintain this much temperature. Any position which is comfortable for mother is fine. Says no, patient can kneel, patient can lie, patient can lean on her side on the pool, patient can lie on water, that pool itself. So patient can kneel, that is on her knees. Patient can lean on the one side of the pool. Patient can completely go inside and keeping the face upward. So any position, there is no fixed position that if patient asks whether I have to be in a certain position or which position is best for me, you have to say whatever position is comfortable for you, you can be in that position. The only thing which we have to ensure that while delivery of the baby had completely submerged during birth. This is again a safety point. While delivery, baby has to be completely submerged. It has to be inside the water when baby comes out. Baby should not come out in air. Baby head should come out in water. So this is again a buzzword. Which position I can should opt for, doctor, or whether I can lie, whether I can do this, that, any position, Sarah, which you find yourself comfortable. The only thing is that at the time of delivery, baby has to deliver inside the water. Baby head has to be delivered inside the water, completely submerged. Other buzzword, I'm sure most of you are not aware. Are you girls aware that 2 midwives are important for birth of the baby in water pool? How many of you were aware of this fact?
No, ma'am.
2 midwives has to be there at the time of the birth. If only one midwife is there, then one midwife coordinator or an other medical healthcare professional person has to be there. But you are going to say 2 midwives. Now, if it comes as labor ward, girls, I'm going to cover if it comes as SD, if it comes as a task, or like one of the agenda in the task, or even if it comes as labor ward prioritization. This time, there was one girl was saying that one candidate was saying, or one role player was like in labor ward prioritization, one of the room was that she was looking for water birth. You mention everything, but if you did not mention certain things, that like 2 midwives are present, that is patient safety point. If you utter this word, examiner would come to know that you have gone through water birth guidelines, water birth leaflets, you have read about water birth. Unfortunately, I will not mention the name of my mentor. When I asked my mentor, should I go to water birth, she straight away said, no need. And in my exam, it was complete task about water birth. So water birth is very, very important, and some buzzword. 2 midwives are present at the time of birth. Someone has to be there all the time when mother is in pool. Means if one midwife has gone for some reason somewhere, one midwife has to be there. You cannot leave laboring mother inside the pool alone, because in labor ward, we leave at time laboring mother alone, right? We do leave, no? That we leave labor mother, okay, I'll come again. That we do in labor ward prioritization, that we'll put cannula, we'll send this, then we'll come again and we'll do the partogram. If it is like a low risk pregnancy, if there is shortage staff, we do say that thing, no? Fari, we do say, right?
Yes.
Here you are not going to say this thing. Someone has to be there all the time when mother is in pool. So 2 midwives, whatever position she is comfortable with is okay with us. Only thing is that baby had completely submerged during birth. That is important. 2 midwives, someone has to be there. Now, next, hands-off approach, which is but obvious, but you have to mention that this is going to be hands-off approach, means baby is going to deliver on its own. Now, this is again important. Following the birth, baby's head. Following the birth, baby's head will be gently guided out of the water by midwife or even by mom herself. Once the baby is born, baby head will be gently guided out of water. So you are going to deliver in water, then gently you are going to bring the baby's head out of water. Even mother can do herself. Once baby born, head must not go back into the water. This is again a common sense to prevent inhaling water. So first you have to deliver head in the water, deeply submerged. After delivery of the head, you or midwife can guide, or the patient can herself, and taking out the baby's head gently after Once baby head is in the air, it should not go back into the water, because now there will be risk of inhaling water. But once baby is born inside the water, there is no risk of inhaling water, because this is the question normally role player asks. You will my baby will deliver inside the water, he or she may inhale water. Then you have to say, once baby is born inside the water, baby does not inhale. Then we gently take out the baby. You can do yourself, or we will guide you, or I'll do it. But once baby head is out, we will prevent going back in the water, because that point of time inhaling of water is important. Now this is such a number 4 point. Such a beautiful point. You will love to hear that. Babies born in water tend to have eyes open, very calm, and take a short time to become pink. Sometime, not always, but sometimes short time to become. Normally when we do delivery on land, the moment baby is out, there is immediate cry. Sometimes we have just delivered the heart, we couldn't even deliver complete body, and baby started crying. Baby starts crying. It does happen, right? And baby is absolutely pink. But in water, it is different. Baby comes with eyes open, which is normally with the land birth. Baby is very calm. Calm means there won't be vigorous cry. There won't be immediate cry. And baby would be very calm. There won't be vigorous baby movement. And baby may take short time to become pink. But this is all normal. This is all normal. Why? Because water birth is gentle, and that's why baby does not have that vigorous activity or cry. Though in land birth, baby delivery, we ask patient to push, then we do something, then maneuvers, then we are like lateral flexion of the baby, then posterior, and this. We do so many things. Land birth is not very gentle. That's why baby may deliver, or normally delivers, with vigorous cry. That is again a buzzword. Doctor, I don't know, one of my friends, she had water bath, but baby couldn't cry immediately. Then baby was in NICU. That was because of the water bath? No. Then you have to mention it that baby born in water with open eye, very calm, not a vigorous cry, not a vigorous movement. Sometimes even they take time to become pink as well, but that is all normal, because water birth is normal. She might be in NICU for some other reason, not because of water. Farzana, are you getting my point? Farnaz?
Yes, Dr. Pooja.
Yeah. So am I clear so far?
Yes.
Okay. So now moving further. So I'm preparing you. What if she asks this? What if she asks that? If she examiner asks this? What if your examiner in labor board prioritization asks a particular question? You should be aware of all the facts. So whatever question they throw at you, you will answer like this. Right? Just imagine it's a labor board prioritization. You have just taken handover. It's 8:30, and you came to, now you have been given 8 rooms. In one room, Sarah had water birth, been 15-20 minutes. Baby did not have immediate cry, and baby took some time to become pink as well, or baby took some time for cry or vigorous movement. This is the situation. If you're not aware of what exactly happens in water birth, you may probably tag it as urgent. Oh my God, Abgas code must be this and that. No. Here you can tag it as semi-urgent. You won't take it as routine, but not urgent as well. You will give explanation. This is a semi-urgent case for me. I'll send my ST this, and pediatric ST, because in water birth, being pink, turned to pink may take some time. There is a possibility of not having vigorous cry or vigorous baby movements, because it is the effect of water birth, which is gentle, and this is normal with water birth. Here you score the marks. Here you get the marks in patient safety and applied clinical knowledge both, and communication with colleague as well, because you are unnecessarily not calling your consultant, oh my god, something happened to baby. No, because you are aware of all the facts of the water birth. This is normal. Clear? Now, baby typically breathes when they sense change in the environment, that is from water into air. That's the beauty of the water birth. Why baby does not breathe inside, or why baby does not inhale? Because baby breathes once they sense change in the environment from water into air. Somebody will tell me why this change does not happen during the delivery? Anyone? Why this change does not happen when they deliver in water birth immediately inside the water? Anyone? Just a common sense.
Because they come out from amniotic fluid.
Lovely. Who was this? Who was this? Who was this?
Farnaz.
Lovely, darling.
Farnaz.
Lovely, lovely. Because there was no change in the external environment. They were in water and they are in water. So how they will realize that? Is it water, kind of water might have changed, but it is a water at the end of the day. So they only sense change when they are water, from water into air. That's why once you guide baby's head in the air, then baby starts breathing, and that's why now you have to be very careful that baby's head should not go back into the water, because now baby's mouth is open, baby is inhaling, baby is breathing, baby may inhale water inside. Breathing does not occur underwater. There is this third line is just to explain you, no need to remember this. That is a complex chain of chemical, physical, and hormonal responses initiates water birth. Means how this breathing happens? Breathing happens because of a complex chain of chemical, physical, and hormonal responses which is initiated by water birth. Right? This is a line which you can remember if by any chance your examiner in labor ward prioritization asks why baby is not breathing inside, or why baby did not breathe inside, why baby only breathe outside, then you will say because of the change, and there are certain changes, complex chain, which is initiated by the water birth. During birth, baby's head is totally submerged, so breathing reflex is not triggered. This is an answer which you have to give to your examiner probably, or probably if you have a role player who is very educated, very light, maybe some CEO, something, she may ask, why baby did not breathe inside immediately after delivery? Then you will say baby did not, or Jack did not breathe immediately after delivery because baby head is totally submerged, so breathing reflex is not triggered. It is only triggered when Jack's head came into the air from water. So this is how you will answer whatever question comes towards you regarding water birth, because I have jotted down all probable questions which they can ask. Now, birthing partner. Birth partner not allowed inside the pool. This is a bit controversial, I would say. Some leaflet says that they allow, some leaflet say that they cannot go. I've gone through guideline, they have not clearly mentioned about it. I have particularly taken at brother not inside the pool. Reason being, because in pool they are clearly mentioning that between two delivery they change the water. They just take out the water, they rinse that pool, and they again fill it, and they do the de-infection. So if partner is inside, then midwife can also be inside, right? So their basic principle of water birth is that it has to be disinfected, it has to be clean, there should be hygiene maintained. So According to that, I have chosen the leaflet which was saying that birth partners are not inside the pool. How? And how you are going to say that? Sarah would say, no, I want John to be inside. Then you will very gently you are going to say, we respectfully request your partner to refrain from getting into the pool. Or we would suggest or we would advise that partner to refrain from getting into the pool. Very gently you are going to say this thing. So what is the role of the birthing partner? Physical and mental support, helping her to feel relaxed and cared for. So basically mental and physical support. Keep room calm, to keep her breath steady and to stay in control. In nutshell, bottom line, physical and mental support to make her relax, to make her calm, to breathe her steadily and to stay in control. So role of birthing partner would be mental and physical support to laboring mother, to feel her relax, calm, breathe steadily and stay in control. This is very important. In most of the guideline, in most of the water birth leaflet, it was given to stay in control. I personally feel because water birth is a different thing, that you are inside the water. So getting panic, chances of getting panic is more. So to stay in control, that's why in all leaflet they have mentioned this line. So I would suggest, if any question regarding birthing partner, you will say physically, mentally support the laboring partner, and do mention that to feel her relax, calm, breathe steady, but do not forget to mention to stay in control. According to me, this is a bold letter statement, because this is given in most of the leaflet to stay in control, and logic because there is more chance of getting panic inside the water pool if anything happens like untoward or not favorable. Be now birthing partner, how this is again very important. This whatever I have given in black bold letters, these are the lines which were mostly in all of the leaflets and the guidelines. Birthing partner should massage her shoulders and arm, which will keep her staying calm. No need to say again that. Just massage her shoulder and arms. Very important buzzword and the safety point. If you swim, if any of you swim, if you go into swimming pool, did you ever notice that when you are very long inside the pool, you feel thirsty? Anybody is a water bird? Anyone? No, no issue. If any one of you have ever experienced to be inside the water pool or the pool, you must have noticed that after some time you feel that you want to drink something, because it causes dehydration being inside the pool for very long. So again, this is a buzzword. When you will discuss about the plan of action, about the water bath, you are going to say that, Sarah, during your stay or when you will be inside the pool, you will be offered frequent cold drinks to keep yourself hydrated or to avoid dehydration. This is an important buzz line. This you have to say, because this is patient safety. If there would be dehydration, patient will feel anxiety, patient will feel restlessness, patient may even faint. So drink frequently cold drink to avoid dehydration. This we have to offer. It's a buzz line. Assisting her in changing position by midwife. Yes. Face cloth, rinse in cold water. This is again a buzzword. Face cloth, rinse in cold water to keep her cool by birthing partner. Again and again, one question or one line is coming frequently to keep her cool, because there would be a risk of dehydration. So face cloth, again to wipe her face, because with cold water, it has to be soaked in cold water. So it will keep her face, because face is out, no? Face is not inside the pool. Face is out. So face, cloth rinsed in cold water to just Tap, dab, dab, dab on her face, offering the cold drink to avoid dehydration, massaging her shoulders and arm. Birthing partner will support mentally, physically to feel her relaxed, to keep her calm, and to stay in control. This is how you are going to talk about birthing partner when she will say, will you allow John to be inside the pool? I'm sorry, I'm afraid it is not suggested to be inside the pool or the partner to be inside the pool because of some infection reasons, but he's supposed to be there around, massaging your shoulder, massaging your arm, to support you mentally, physically, keep you calm, help you in steady breathing, and to stay in control. He would be offering you frequent cold drink as well to keep yourself hydrated, and face cloth, rinse in cold water to wipe your face to make your face cool. Am I clear so far, Sarah? Right? Now, next. In case of normal labor and birth, can stay in water to birth placenta without assistance of drug. Now we are talking about the third stage of the labor. Placenta can be delivered inside the water. It is absolutely patient's choice until unless we are suspecting major bleeding, we are suspecting retained placenta, we are doubting any tear. In that case, we can ask her to exit pool immediately and doing the placenta removal outside. But if everything is under control, baby is fine, mother is fine, she can deliver or she can give birth to placenta without any assistance of the drug inside the water. She can stay in the water without any assistance of drug, and there would be physiological management of third stage of the labor, that coming out of placenta itself. But sometime you may offer her oxytocin drug as well in form of injection. In that case, she has to come out, or she can take in her buttocks as well. How she will take in her buttock? She will just lift her buttock, midwife will give injection, she will again go down into the pool. Or she can sit in pool steps, there are steps no to get inside the pool. She can sit in pool step and midwife can give injection there. Or she can just lift her back from one side and she can be given intramuscular. Or if midwife or healthcare professional thinks that she needs intravenous because there's slight risk of bleeding or something, then we have to ask her to leave the pool. Am I clear so far? Fatima? Fatima? Fatima, can you hear me? Fatima, I will not move forward until you say yes or no. Fatima? Fatima is sleeping. Fatima? Fatima, are you there?
Yes, ma'am.
So, can I proceed further? Fatima, can I proceed further?
Yes, ma'am.
Okay, great. So in case of normal labor birth, she can stay in the water to birth placenta without any drug assistance. There is no need that she has to come out to deliver the placenta. Oxytocin drugs, if needed, can be given intramuscular or IV depending upon the situation. Intramuscular can be given inside the pool, just she has to lift her buttock or sit on the pool step, or IV, if it is IV required, then she has to come out because IV cannot be given inside the pool. Laboring mother may need pad on the floor of pool or side of the pool. Obviously, how she is going to sit on pool? There will be a pad. Pad means a kind of mattress or something like that. Or if she wants to lean on the side of the pool, right? Again, we will provide her some pad so she can lean on that pad. This is a common sense. Now, what all birth supports we offer with water birth? Straws, massage, music, and obviously helpful birthing partner. Mother encouraged to put baby on them skin to skin. Immediately after birth, here also we encourage skin to skin contact. Do not think that because inside the water, so you are not going to encourage skin to skin contact. It is again encouraged to skin contact. That is the basic formula all over the world. Cannot book pool. This is a question, darling. She can ask, can you book pool for me, doctor? They cannot book pool in advance in hospital or any birthing center, though they can register their wish. Getting me? You getting me, girls? They cannot book water birth pool for themselves that whenever I come in labor, you have to arrange a pool for me. No. There is no booking for pool in government. We are talking about NHS. If they want to book something in private, that is their call. But in NHS hospital, in NHS birthing center, in NHS midwifery center, they cannot book pool. They can only register their wish either to midwife or to consultant or to the hospital. Again, this is an important question because Farheen, Farnaz, Fatima, Sadia, Sidra, Vijay Lakshmi, they can ask, can you book pool for us? And what is the procedure of booking a pool? You have to reply this way. This can come as labor ward prioritization as well. That patient has come for in spontaneous labor and she was willing for water birth and there is no pool available. Can she claim for something? She cannot claim for something because she cannot book for this. If she has come for induction of labor, then what should be the scenario about water pool that I'll let you know later on. So, important point, she cannot book. Register, she can register her wish. Skin to skin contact, again important even in water birth. Telemetry, I think you all are aware of telemetry, that is wireless monitoring can be offered in high-risk cases like VBAC. A patient is adamant that she wants to go for water birth, she's okay with the hospital delivery, but she wants water birth. In that case, we are not going to offer her intermittent auscultation. We are going to offer her wireless monitoring. We call it telemetry. So this is how you are going to tell her that in case you still want to go for water birth, after you tell her all the risk factor, then we'll suggest you telemetry, that is the wireless monitoring of the jack's heart continuously. Hoist. Hoist is a very important prerequisite which should be there near side the pool. It should be a side pool because what is hoist? Hoist is if patient becomes unwell, then you have to lift her up. You need hoist for that. You understand hoist? I'm sure everybody must be aware of what is hoist all about. That we tug and then we remove something, right? So this is again a buzzword. When you will explain the patient, you will say that there will be hoist available to remove in case of any emergency, or if it is an SD, or if it is labor ward prioritization, then when you will say that, okay, I'll send my midwife, she will go, she will talk, and she will discuss about the risk and the advantages of this, there she is going to, you are going to mention that she will make sure that availability of the hoist nearby water pool, because that is a safety point. You have to mention that. Now, who can have water birth? Low risk, beyond 37 to 42 weeks. Beyond 37 to 42 weeks. Anyone who is less than 37 or beyond 42 weeks, not advisable. It has to be one baby, twin babies, not advisable. Head down, obviously breech, transverse, not advisable. So these are the basic prerequisites. Low risk, 37 to 42 weeks. It has to be single baby, head down position. Even, again, there is a myth. We think that only very low risk patient can go for water birth. No, even if there is small intervention, like induction of labor. Again, there is a myth that induction of labor cannot go for the water birth. Can go for water birth, because the criteria of water birth is that one, she is in active labor. So induction of labor we would do in the labor room. Once she is in active labor, once she is 4 to 5 centimeter dilated, getting 2 contraction in 10 minutes, then we'll offer her water pool. So again, that is a myth that induction of labor, you cannot offer water birth, which is wrong. Even there is premature rupture of membrane, you can offer water birth. Yes, it is very important. Even intrapartum anaphylaxis, you give that. Sorry, intrapartum antibiotic you give for GBS, right? That is also can be done in with water birth. Clear? Clear, girls? Yeah, I like active participation. Otherwise, it seems like
Yes,
that I'm
Dr.
talking too
PUUJA,
much.
but it is
Yes,
written
ma'am.
that, hello,
Yes, ma'am. Yes,
Dr.
ma'am.
PUUJA,
Hello.
it is written that induction of the liver when the overdue. So you told here that up to 42 weeks.
Sorry, come again. Come again.
Overdue means
And the
40, more
next
than
line
40
is that
weeks.
induction.
No, but it is clearly given in guideline.
No.
It is clearly given in guideline
Mhm.
water birth that beyond 37 to 42 weeks, she can opt for water birth. You are saying that you do not go beyond
So
42 weeks.
induction of labor is done before 42 weeks.
You are asking
Okay.
which question? Like, come again with your question, please.
I am asking about when she become overdue.
Yeah.
And so it means that when induction
Normally, see, again, overdue, we can call from 40 weeks onwards till 42 weeks. There, they sometimes wait even after 42
Okay.
weeks. So definitely, induction of labor beyond 42 weeks, we are not going to consider water birth. 40, normally nowadays, even they also, beyond 40 weeks, they also consider it as overdue. If it is more than 41 weeks, it is overdue. So overdue, induction of labor for overdue, but it has to be between 37 to 42 period and this thing. Because this was something very important, a small intervention. This can come as labor ward prioritization question. Because I am sure who has not gone through the guidelines, because there are two guidelines and there are so many leaflets about water birth, I can't tell you. So until you go through everything, you won't be able to answer every question, because none of the leaflet is complete. None of the leaflet is complete. None of the guideline is like given completely. Then I have to look something for there for something. This is what I prepared for myself. So I just now, what are the risky situation where we normally advise against water birth? Any medical condition patient has preeclampsia, hypertension, diabetes, asthma, we will not. Any serious infection, if patient is having any serious infection like HIV, we will not definitely advise. Complication in present or previous pregnancy, and delivery. Probably a patient had say third degree, fourth degree perineal tear in the previous pregnancy, or in the present pregnancy she had large size baby, or anything which is comes in high risk, is something which we will never advise, we will never offer her, we will never consider water birth. But as you know, in NHS, we always appreciate her concern first. We always say that it's a very good option, then we talk about the risk, right? If BMI more than 35, again, in some leaflet it is 40, in some leaflet is 35, but in most of the leaflet it is 35. So I have taken it as 35. If BMI more than 35 or more at the time, or equal to that at the time of booking, that is again a very important funda which you have to be clear about. When we talk about BMI, it is mostly at the time of booking, mostly at the time of booking. If you decide about the whether this patient need GTT or not, it is not what her BMI at 24 weeks, it is decided what was her BMI at the time of booking itself. Okay, so BMI more than 35 at the time of booking, or if weight gain is 20 kg or more. Okay, as more chances of larger baby and possible complication during birth, all about risky. Okay, so this is clear. So medical serious condition, in any complication in present previous deliveries or pregnancy, I think this is something which you will say just like that. What you need to remember, BMI 35 or more than that at the time of booking. If weight gain 20 kg during pregnancy, because if in both the cases there are chances of having the larger baby, and definitely possibly complication during birth, you may need to apply some instrument. There can be perineal tear, there can be retention, there can be PPH. So in these conditions, normally we do not suggest, or we suggest against water birth, not in favor of water birth. So what if laboring mother has complication or high risk? So how to counsel? You may use pool during labor. This is again the beauty of water birth. You may use pool during labor, not for birth. We would suggest you to exit pool while delivery. How does it sound to you? If BMI is on the higher side, 20 kg weight, so we are doubting about the larger size baby. We are doubting about the instrumental delivery. Patient has PPH in previous pregnancy, there's a chance that she can have PPH in this pregnancy as well. So how would you counsel her? You will not say that you will not go for water birth. You will say you may use pool during labor, not for birth. We would suggest you to exit pool while delivery. Isn't it a beautiful line, girls? Isn't it a beautiful line that you are offering her water birth as well, but simultaneously you are taking care of her safety as well? And this is clearly given in guideline. This is clearly given in leaflet that you will not say no to water pool. You will say that labor, you can enjoy water pool, but for birth, it is suggested that you come on land and we'll do the land delivery. Clear, girls? Clear? Pareen, is it clear, darling?
Yes, ma'am, clear.
Okay. Okay. Fatima, is it clear? Okay. Now, how to appreciate? As I told you, patient comes with whatever idea, even personally you think what a shitty idea, still you have to appreciate that. So if a patient who has VBAC, if a patient who had perineal tear, third degree in previous pregnancy, a patient who had BMI 40, baby's weight is around 4.3 kg, and she is willing for a water birth, you will never say what are you thinking, what shitty idea is all about. No. Once you will reach to the second part of the task, means after examination, once you will talk about the water birth. So you have taken the information gathering. Now you have done the examination in presence of chaperone with the consent that, okay, I'll check baby's heartbeat, blah, 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 blah. Now the second part of the task. Sarah, I understand your choice of going for the water birth. It is absolutely a beautiful choice of delivery the baby inside the water. I appreciate your choice. It has several benefits like less painful contractions, less need for pain relief, shorter labor, reduce risk of tearing, increase likelihood of achieving natural birth, more enjoyable experience, less interventions. Water supports your weight, allowing you to feel buoyant with easier mobility, making you comfortable and conserve your energy for labor. Warm water helps producing certain chemicals, that is endorphins, promoting body's natural pain relief mechanism. So this is how you are going to appreciate. I appreciate your choice of water birth, Sarah. It has several benefits. I repeat, less painful contractions. I just bold first letter. Less painful contraction, less need for pain relief, shorter labor, so less painful contraction, less need for pain relief, shorter labor, reduce risk of tearing, fourth, increased chances of normal delivery, and more enjoyable experience. This is how you are going to first appreciate her choice, mentioning all these 5, 6 bold letter lines. If you can remember this much, you can say that water supports your weight, allowing you to feel buoyant, which easier mobility, make you more comfortable, which conserves your energy for labor. And water helps producing certain chemicals which acts as natural pain relief mechanism. That's why patient does not have that painful contraction. Why patient is not having that painful contraction? Because warm water releases certain chemicals. When you come from your hospital and you're very tired, what you do? You take a shower. You take a shower of lukewarm water, isn't it? And immediately after taking shower, you feel relaxed. Why? Because this warm water releases endorphins in your body. So whenever we come from anywhere, when we feel very tired, we normally take warm water shower. We never take cold water shower. We always take lukewarm water shower. Why? Because it releases endorphins, which automatically decreases your pain. Clear? So how?
Yes.
Yeah. Who will speak it for me? Because Farzana and Fareen and Fatima, these 3 girls are active. So I'll ask all 3. First, Fareen. So Sarah has come. How will you appreciate her concern for water birth? She is having a weight of say 38 BMI, was BMI at the booking. Now she has come with the wish of water birth. Now you are going to start your second part of the task, information gathering and examination already been done.
Okay.
You have to just read. Yeah.
Yeah, Sarah. Hello, Sarah. I'm Dr. Fareen. Sarah, I appreciate that you've taken the choice of having a water birth. Benefits like your pain will be less. There are more chances that you will deliver naturally. There will be, since you will have less pain, so we will not need to give you painkillers. And it is enjoyable, and we will need to do less interventions like giving injections or using any instruments. Are you getting me, Sarah?
Yes, yes, doctor.
Sarah, I can also see that, Sarah, as your weight is slightly on the higher side, so having water bath is also an advantage will allow you to feel buoyant, so that you can mobilize easily, and it will be comfortable, and there will be less energy loss while you are laboring. Yeah.
Only one thing which you have mentioned, which you are not supposed to mention, that, funny, that your weight to height ratio is on higher
Yes.
side. Do not say that you have. You
Okay.
say that women who have the women who has weight to height ratio on the higher side, water bath is helpful for them for easier mobility. It makes them more comfortable and conserve
Okay.
their energy because they feel
Mhm.
buoyant. Clear? Never say you. Say women.
Yes. Okay. Mhm.
So now,
Yeah, yeah.
Farnaz,
Got it.
your turn. Farnaz?
Hello, hello.
Yeah,
Yes.
Farnaz. Now it's your turn. You have to appreciate patient choice.
Okay. Okay, Sarah, I appreciate you to deliver in the pool, and it is has many benefits. You will feel less painful, less need of pain relief. During the labor, your labor will be so smooth, and there is less chance of tear and intervention,
Very good.
and you will enjoy the liver. But Sarah, I would like to say one thing is that your ratio is towards the higher side. Okay.
Again, you are committing the same mistake which Fareen has done. I just now,
You can
were you not there, Farnaz, when I was asking Farnaz?
you
You not mention that your weight or height ratio is on the higher side. I just mentioned that, right?
oh, the woman, yeah, yeah, woman whose weight to height ratios was the higher side, they will feel less weight when they are in the pool and can move easily. But they are allowed to go into the pool during the labor, but they do not give birth in the pool.
Do
Okay.
not say this much. Do not say this
Very
much. No, do not say this much. Farnaz, when you are appreciating, only say positive points. This we'll discuss later on. Because as of now, you are
okay.
appreciating her choice. So you will
Okay.
say, I appreciate. It has many benefits, like your
Mm.
pain will, there will be less painful contractions, there will no less need of pain relief, your labor will be shorter, there will be less risk of tear down below, there will be more chances of delivering normally, there are more chances of there will be less need of any intervention, right? And you will be having an enjoyable experience because this warm water helps in releasing certain chemicals which itself act as pain relief. And
Mhm.
women who has water to hydration on the higher side, they always feel lighter in water. So there is easy mobility, you will feel more comfortable and can
Yes, yes,
conserve
yes.
the energy for labor as well. So how does it sound to you? But Sarah, I have few concern as
Okay.
now you will talk about the risk. Always make a rule. I appreciate your choice. Then
Mhm.
dash, 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 dash. Then, but I have few concern as well. Then again, dash,
Mhm.
dash, 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 dash. Okay, I appreciate your choice. Dash, dash, dash. But I have few concern as well. Dash, dash, dash. This is how you have to present if there is any case of negotiation. I appreciate, then your points, but I have few concern, then your points. Okay. Now, then you will
Okay.
say,
Yes.
however, there
Okay.
is no hard evidence to prove how better or worse, safer or less safe water worth is. Again, this is a very controversial statement because in guideline, not in guideline, sorry, in one leaflet, they are saying that it is extremely safe. In same leaflet, somewhere they have mentioned this as well. So in same leaflet, there were two contradictory statements. One, they are writing extremely safe labor, and simultaneously they are writing this as well. So I would suggest you should always bring the negative points definitely forward. because that is related to patient safety. So I would suggest, if you get the time, or especially if it is SD, always mention that. In SD, it is very important. However, there is no hard evidence to prove whether it is safe, unsafe, or whatever. Okay. You remember this line just in case if any SD and they're asking about water bath. Now college has become very experimental. I personally think because now college is very much aware of the fact that there are many groups, there are many mentors, there are many courses, and somehow it is difficult to control that recall issue, that leaking of recall. Are you getting me? So now they have become very experimental. Now they have started experimenting, and that was very much evident in this November exam. That's why I've decided that not only I will go with my regular course where you are going to present your recording and I'm going to give you feedback, then my answer key channel, which is separate, this and that I'm going to continue with my course, but simultaneously I'm going to take these live sessions as well. So whoever is my paid student, they are going to get it for free, but who are not my paid student, who are like just my free group, they are supposed to pay for this, because I really put lots of hard work in that, right? So I'm going to take certain important topic in next 2-3 months, so you can cover this experimental attitude of college. You will be able to handle. I'm like, are you, like, do you find it sensible whatever I'm saying?
Yes, yes, doctor. Thank you.
Okay, so for now, okay. I don't know why Farin is not able to join. I've given her permission anyways. So next is Farin. She's joining from 2ID or what? Farin? Farin, I think you have already joined and there is one more ID showing your name. Are you trying to join from two different mobile or equipments?
I just got disconnected.
Okay, so
Hello?
just remove one, okay? Farin, remove one, okay?
Okay.
Yeah. Remove the other one. Okay. Yeah, it's removed now. Okay. So now, so normally water birth, when it is VBAC, when it is perineal tear, it comes as negotiation. So if VBAC, then say first appreciate her choice by mentioning the positive points. Positive points were these, right? So I appreciate your choice. This, but I have a few concerns. Now, being VBAC, what is going to be your concern? You have already discussed about home and the hospital delivery, right? Where you have already mentioned that we do the continuous monitoring of the baby. So if we come to know about the rupture, if there is any fetal distress, there is a risk of torrential bleeding, the baby can die inside, you may need the blood transfusion, so we need to deliver immediately, blah, 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 blah. That you have already mentioned, that's why we prefer hospital delivery. Now, she is asking, okay, I'm okay with the hospital delivery, now I want water birth. So this is what you are going to say. I appreciate your choice, and you will mention the positive point. Then you will say, I have a few concerns as well for water birth, that water birth will be, I don't know what's the problem with, sorry. Okay, so but water birth will be challenging as monitoring is possible with waterproof wireless equipment. We call it as telemetry, but need to act immediately if ruptured. So can discuss with consultant. So arranging a meeting with him, can meet with your birthing partner. This is because already you have mentioned about advantage of hospital delivery for VBAC. So you're not going to talk about all in detail, that torrential bleeding, fetal bradycardia, 3 out of 4, because that you are going to do first. Because her first concern that I want home, then I want water bath. So first you will consent, no, please do not go for home bath, go for the hospital delivery. Okay, I'm okay with the hospital delivery. Now I want water bath. So now you are going to talk about it. I appreciate your water bath, but what the concern you have? Water bath will be challenging, right? Monitoring is possible with waterproof wireless equipment. We call it as telemetry, but need to act immediately if ruptured. That is difficult with water. It won't be smooth, right? That is difficult with water pool or water birth. Clear? Water birth will be challenging as monitoring is possible with the waterproof or water lake recall, but need to act immediately if ruptured. And that is difficult with water pool. Why? Because we cannot act immediately. No, we have to bring her out of the water pool, then we have to take her into the OT. So it won't be easy to act immediately, need to act immediately if rupture. That is difficult with water pool. That's why water birth will be challenging. Clear? Now who will say this thing? Now both Farnaz and Farheen. Patient has
Yes.
come for VBAC. You have to start the second part where first you will appreciate only about the water bath VBAC. I'm not talking about the home and hospital. And then you have to tell about the risk associated with VBAC in water bath. We'll start first. We'll start first. So
Yes,
this time Farnaz will do first. Okay. Yeah, Farnaz.
appreciate your choice of water birth, and because the water birth, you will feel less pain and contractions are less painful. Yes, you will not require and smooth birth, and you will experience and enjoy the birth. And warm water will also release one of the chemical which is called endorphin, which also but it is Sarah, I am afraid this is quite challenging when the women have previous cesarean section, because need to monitor continuously, which is done by wireless telemetry. What happened in case of the rupture, we need to act immediately, and it will be very difficult when you are in the pool. So I will make an appointment with my consultant and ask with your birth attendant also. Okay.
Yeah, perfect. Perfect. Farheen, it's your turn now. Farheen?
Yeah. Yes, ma'am.
Yeah, now you will appreciate and then you will tell the risk.
Okay. Yeah. So, Sarah, I appreciate that you made a choice of water birth. Yes. With this method, you will have less pain because water birth itself releases some hormones from your body, which acts as natural painkillers. So we need to give less pain injections to you, and it is also an enjoyable experience. And there are less chances of tear. There is less chances of our using instruments. But Sarah, I'm afraid there are some concerns also, like we can do with wireless devices, but as there is a small risk of rupture since you've had a previous cesarean, so in that case, if something like that happens, we will not be able to act immediately, which is required if you're having a water birth.
Which is difficult.
I don't mean to scare you, but
which is difficult
Hmm.
with water pool. Yeah, you have to say this thing because
Which is difficult with water.
before taking her out of water bath, she's pregnant. It will become difficult,
Mhm.
taking out and taking her to the OT. So
Yes.
that is the only challenge. Okay, if you want to mention that, as you are saying, there is some risk
Yes.
of rupture,
Yes.
rather than saying Farin, some risk of rupture. If you are saying, then better you say
Yes,
1
ma'am.
out of 4 women.
Mhm.
Sorry, 1 out of 200
Okay.
women,
Mhm.
1 out of 200 women may have the risk of rupture,
Mhm.
rather than saying some risk. Okay, because 1 out of
Okay.
200 is so very common that
Okay.
our
Okay.
examiner expect from us that we should be aware of this ratio, right? So this is how you
Dr. Pooja,
Yes.
we also have to mention about the cesarean section because 1 in 4 will require cesarean section.
no,
So you will
no,
need to
no,
come.
no. See, here what is the issue in my exam? She was looking for the home delivery and then the water birth. So first I had to convince her for the hospital delivery. There I mentioned that going for the home delivery is a very good option. There will be familiar environment, comfortable situation, all your family around. You can see your baby, your previous baby, your partner can be there, your midwife, who is your regular midwife, would be there. So definitely there won't be intervention, there won't be any buzz, anything, this and that. And 3 out of 4 women deliver normally as well. But I have few concern as well. 1 out of 4 women may need emergency cesarean section, and that is normally at times there is risk of 1 out of 200 women may giving away the or a part of the previous scar, and that we can come to know only about the continuous monitoring of the Jack's heartbeat. We call it as CTG or NST, whatever you call it, because at that time there would be risk of the torrential bleeding with even Jack may die inside. It is a risk to your life as well. We need excessive blood transfusion. I don't mean to scare you, but I have to be very honest about the facts so you can take a well-informed decision. Well, being in the hospital, any such situation, immediately action would be taken, because the moment you will get admitted in the hospital, our consultant, pediatrician, OT, anesthetic, everybody would be at alert. In need of any such situation, will immediately do the cesarean section and would save you and would try our best to save you and the Jack as well. So here you have mentioned about hospital and home, right? She'll say, okay, doctor, I'm okay with hospital, but still I want water bath. Then first you will appreciate water bath. You don't need to say 10 lines. Even if you could remember the first paragraph, that less painful contraction, less this is more than enough. Then you have to say that this is important, that water bath will be challenging. Water bath will be challenging. Why? Because when we need to act immediately, when it is ruptured, or even if it is there is fetal distress, not only rupture, even if it is that fetal distress, like fetal bradycardia, right? It's not necessarily that fetal bradycardia only because of rupture. It can be other way as well, right? So it would be difficult to handle you. Managing her would be very difficult. Clear? Clear, girls?
Yes, ma'am.
So this is,
Yes, ma'am.
yeah, so this was the task basically. Home, hospital, first you have, because in home hospital, if you want to say, there are hardly 4 lines in home and there are hardly 4 lines in hospital. In this way, you are going to finish your task in 7 minutes. And most of the girls were saying that we could finish task in 7 minutes. Though I could finish task just exactly at 10 minutes, because after that I was talking about water bath. Probably she herself did not say that I want water bath. She did not say even a single word about water bath. But second page was all about water bath. That I want this, I want that, I want this, I want that. So probably who have spoken about water bath could clear the task. Who has not spoken about the water bath, even role player did not say anything about that. This is, I'm talking about my exam. That is again a trick. That is again a trick. Somebody may think, okay, I answered every question, but probably they have missed completely the second agenda of the task. That was 10 points given about the water bath. Clear? So first home hospital, she will convince, okay, hospital, then water baths or land baths. So you will convince her about, we will try to convince about land birth. But again, as we say that we have to always honor patients or laboring mothers' wish there. So here you can use this line. You may use pool during labor, but not for birth. Okay? Okay. Now, if patient has history of perineal tear, again, now she has perineal tear in previous pregnancy. Now she is a 36 weeks pregnancy and she wants to understand about water birth. Again, first you will appreciate. You know the lines of appreciation. Now, do mention water warm increases the stretching. First, appreciate perineal that routine. And in perineal tear, you will also add certain line in appreciation that would be warm water increases the stretching of the muscles down below and reduces the risk of tearing and the lower the incidence of significant tears. So when she will say that I had perineal tear, first you will talk about the routine appreciation, then you are going to talk about the specific appreciation that warm, we give warm compression in perineal tear history, no? Perineal tear prevention, there are 4 measures. One is warm compression, right? Right, girls?
Yes, ma'am.
So here patient herself in warm water. So warm water increases the stretching of muscle down below and reduces the risk of the tearing, the lower incidence of the significant tears. But I have few concern as well. In case of previous perineal tear history, it is suggested to support perineum by hands. Water birth is hands-off technique. Here, perineum is supported by hands, warm compression down below, need of deliberate clut, that is episiotomy, especially while applying spoon or cup, which one may need, and midwife will be unable to provide that. This is, you are going to say that I have few concern. So first appreciation, then concern. So now Fareen, you have to counsel first patient for perineal tear who had a history of 3rd-degree perineal tear in previous pregnancy. Now she is in 36 weeks. Now she has come. Now this is the second part of the task, whether you have to negotiate, whether you are going to first appreciate, then you are going to discuss about the risk. Fareen?
Hello.
Yeah. Start.
Yes, ma'am. So I'll tell the general appreciation also, ma'am.
Yes, 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 yes.
Okay.
General
Okay.
appreciation
Okay.
will be always there.
Uh-huh. Okay. Yeah, Sarah, yes, I appreciate that you've taken us having a water birth. Yes, water birth has many advantages, like it releases some hormones which act as natural painkillers. So your contractions will be less painful. We will need to give you less painkillers. There are less chances of tears. And also we need to use less instruments. It will be a very enjoyable experience for you. But there are like and also because as you mentioned in your history that you've had a tear down below during your previous childbirth, so having a water bath will relax the muscle, and so there will be less risk of tearing. But Sarah, there are some concerns in your case, that is when there is a history of previous tear, as in your case. So what we need to do is we need to support the perineum by hands. We need to give you warm compresses down below. And if required, we may need to give a cut down below for easy delivery. And sometimes we may also need to use some instruments, which all these will be difficult if you are going to have a water birth. Am I clear so far, Sarah?
Very good. Very good. Farnaz,
Yes, doctor.
now it's
Okay.
your
So, yes, Sarah, I appreciate your choice. You choose water birth. Less painful, you feel less painful contraction, and the delivery is very smooth. You enjoy delivery of the baby, and warm water also release one of the hormone which is called endorphin, which so you much pain. And the warm water also causes stretching of the muscles, so there is less chance of the tear down below. But Sarah, I have some concerns. The women who have previous tear, we provide them some support by the hand and warm compression. And if they need any spoon or cup, then but is needed, which is not applicable in the water.
which is not
Okay,
possible
Sarah?
to provide, not applicable, say not able to
Yes,
provide.
not,
Able
not
to.
possible.
Okay.
Okay.
Okay. So normally if water birth will come, probably it will come either with VBAC or with the history of perineal tear, but go with open mind on your exam. As I told you, now they are very experimental. So you should be ready with all the probable questions, right? All probable questions. So I hope so far you are prepared. If your role player asks anything about water birth, are you girls confident now talking about water birth? Type at least who does not want to.
Yes, yes, Dr. Pooja.
Okay, good. So now one very important thing which I'm very sure most of the girls were not aware of that. In case of perineal tear, this you have to mention when it is a case of previous perineal tear. Need suturing down below would be done out of water. This is usually delayed in water birth, which is obvious because you have to take out the patient. But is it a concern? No. Why? Because perineal tissue needs time to revitalize following immersion. Because because tissue becomes very friable. So perineal tissue needs time to revitalize following immersion because the patient is immersed in water, right? A perineal tear suture too soon. This is very important line. Perineal suture too soon. Normally, what we think that we have to suture it immediately, right? In this case, if a patient is for water birth and had perineal tear, there is no hurry to suture it until unless there is any heavy bleeding. We have to delay for 1 hour. So what if a question come in labor ward prioritization that there is one patient who had delivered, she had 3rd degree perineal tear, she has water birth. Everybody will rush. This is an urgent case and will do immediate repair. What will you say, Fareen, Farzana, Fatima, Vijay Lakshmi? What are you going to say in that case, darlings? Come on.
Semi-urgent.
It is semi-urgent, and how will you justify? I'm asking, how will you justify? These three, 4 lines. This is an absolute different thing. Otherwise, in 3rd degree, 4th degree perineal tear, what you have read, that we take it as urgent case and we have to do immediate suturing, right? What if they have given just one small word in the end that she had water birth? They have given she had 3rd degree perineal tear, her vital and the last word is water birth. Probably water birth is important. Probably who does not know, they will ignore water birth because now you all 7 girls won't ignore that word water birth, because you know, if it is a water birth, perineal tear need to suture after an hour. This is a guideline fact. So now one by one, tell me how you are going to tell patient about this tear suturing. Yes, yes, volunteer.
Yes, Sarah. Can I say, doctor?
Yeah, sure, sure.
Hello?
Yeah, please, please.
Mhm. Okay. Mm. Uh, the scenario is that the patient has got tear, or I have to mention her.
Patient had perineal tear. No, you just, no, okay. This is a labor ward prioritization. There is a room where a patient had
Mm.
delivered 15 minutes
Mm.
back, and she had third-degree perineal tear.
Mhm.
Taken handover at 8:30 and patient delivered at
Mhm.
8:15. You have taken the handover that Sarah has delivered at 8:15, 4.5, 4 kg baby, and there was perineal tear, third-degree perineal tear, vitals are stable, there is no active bleeding, and in the end, it's a water birth. So
Okay.
now you
So,
prioritize this room, and how will you say, how will you prioritize, and what management are you going to offer?
this this yeah, the patient delivered just 15 minutes ago, a good size baby with the third-degree perineal tear. This is a semi-urgent case. I will send my midwife. Her vitals are normal and her tissue will take some time to revitalize. So I will plan to her seizure after 1 hour after I go for the emergency, and then I will seizure.
After 1 hour of delivery. Mention it clearly, okay? And why? Why? Because tissue needs revitalize following immersion. This line is very important. And if we suture it too early, because tissue is friable, it may affect healing. You have to mention these 4 lines. Again, you tell it again. Please, again present the case. Again present this room.
Okay. So this is a semi-urgent case. This woman has delivered just 15 minutes ago in the water. 4 kg baby was delivered. Her vitals are normal. This is a semi-urgent case. And I will plan to suture her after 1 hour of the delivery, because the tissues are much friable and the healing may be affected if the suturing done early. We
Early.
plan
But
to
why?
suture
Why?
1 hour
Why?
later.
But why? Why it will be friable? Mention that
Because
perineal tissue needs time to. You have to remember.
because immersion in the water.
Yes,
Immersion in the water.
yes. This is buzz
Revitalize the
line.
tissue.
This is buzz line. Clear?
Okay.
Okay. Now
Yeah.
we'll try. We'll try one more candidate.
I'll try, ma'am.
Sure. So now I'll give you a different scenario. I'll give you a different scenario. I'll give you a scenario that I had a tear in my previous pregnancy, now in my 36 weeks of pregnancy, and I'm very keen for a vaginal delivery, vaginal delivery and the water birth. And I have a concern that I did not have nice healing last time because doctors were very busy and they came very late for suturing. So now how we are going to talk about this? Take your time, 30-40 seconds. I don't mind, but give me a proper reply. Yes? Yes. Who is replying?
If nobody, I can.
Yeah, please go ahead.
Um, Hello, Sarah. I'm sorry we did not meet your expectation last time. You had experience. But I will give you some fact that giving the birth in the pool will help. Warm water causes stretching of the muscles and less tear. But the women who have previous the support by hand, warm compression, and a cut may be required when the spoons are applied or the cup. Okay. So 1 in 7 women, Sarah, gain. And if the given the birth inside the pool, vitalize. Okay. So if there is no emergency and you are not having the severe heavy bleeding, plan to suture it 1 hour later, because suturing too early can impact on the symptoms and can affect the healing.
Why? Because of immersion in water. Okay. Now, a few very important points which you should remember, because if she asks what if something happened wrong or if I'm not well or some emergency. In case of emergency occurs in pool, there may be delay or challenging leaving pool which can impact management. This is both for VBAC and perineal tear, right? Because if in perineal tear there is bleeding, then it becomes an emergency, because it is not only about suturing, it's about controlling bleeding as well. So whether it's VBAC or perineal tear, when you will talk about the risk, this is the common risk, which, as there are some common appreciation factors, there are some common risk factors. So common risk factor is, in case of emergency occurs in pool, there may be delay or challenging leaving pool which can impact management. Second, there is a possibility emergency will not be managed as effectively as in labor room or land for that matter. So you will appreciate common appreciation, then common VBAC risk factor, then perineal tear, common appreciation, then special appreciation for perineal tear, then risk related with perineal tear, risk related with VBAC, then in end you will say these two lines as well as common risk factor, both in VBAC and perineal tear. In both cases, in case of emergency occurs in pool, there may be delay or challenging leaving pool, which can impact management. Obviously, delay or challenging leaving pool. There is a possibility emergency will not be managed as effectively as in labor room or land for that matter. Emergency will not be managed as effectively as in labor room or land for that matter. Land means water birth and land birth. So these two lines you are going to add in VBAC and perineal tear risk. So you will talk about the VBAC risk, you will talk about the perineal risk, and you will also add these two lines in the end. Am I clear?
Mhm.
Okay. Now there are certain questions. If she asks, you should be aware of that. How you take care of the pain, how you relax patient, breathing and relaxation techniques, massage, music. Now, which pain relief you offer? Entonox. That is, if you are explaining the patient, then you will say air plus gas. But if it is SD, then you are going to say nitrous oxide and oxygen. So for patient, you are going to say air plus gas, we call it as Entonox. We cannot use opiates, dimorphine, and even pethidine is also not advisable because it may cause drowsiness. It may cause drowsiness. Even epidural is also not advisable. If dimorphine has been given, then again it's a buzzword, 2 hours waiting. If labor ward prioritization comes, that patient has been given dimorphine and now patient is looking for the water birth. Earlier, there was no pool available. Now the patient had delivered and the pool is empty. Now she's insisting for pool. What would be your reply? That because in labor ward there are multiple columns: name of the patient, age of the patient. First is room number, then name. Second column is name. Third column is age. Fourth column is weeks of pregnancy. Fifth column is usually analgesia. So if it is given there that patient has been given pethidine or diamorphine, now, and in description it is given that patient is looking for the water bath, now the pool is available or pool is ready, what you are going to tell? Farzana, Farnaz, Fareen, Fatima, one by one, unmute yourself and reply this question. Fast, fast, girls. It's already 2 hours. Still many more slides. Come on, come on, come on, come on. Fast, fast, fast. It's very simple, dear. Come on, anyone. Anyone.
Yes. I have to explain all the thing, yeah, or she has taken diamorphine.
Yeah, this is labor ward prioritization room, the room number 1. Patient name is Sarah. She 38 weeks, right? Spontaneous labor. Okay. And she was given diamorphine. And now she is otherwise low risk. She was willing for water baths. At that time, pool was not available. Now pool is ready.
Okay, so this is a semi-urgent case. I will send one of the midwife to Sarah, ensure that the pool is available now. But at the same time, I will tell her, as she has taken already the diamorphine, which causes drowsiness, so we will allow her to go into in pool after 2 hours.
After 2 hours, then rest normal. What you talk about water bath, that you will talk about that. Meanwhile, she
Okay.
will be in the labor ward, and there will be partogram and fetal monitoring, etc., etc., etc. The buzzword is that we will not allow her to go into pool until after 2 hours. That is the safety point, and that is the only thing they are looking for. And what happens in exam? Students think, oh my God, I have spoken so much about water birth, there's this, that, blah, 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 but they missed very important point. If your examiner will ask, so will, okay, so now she wants to go for pool. You'll say, yes, I'll send my midwife, she'll go, and we'll, because she's a low risk patient, there is no high risk, her vitals are okay, there is no medical condition, no surgical condition, this is a second pregnancy, first delivery was normal, so we will allow her for the water bath, and my midwife will take care of this. You lost that room completely. Student thinks, my God, I have answered so nicely. Why I couldn't clear the exam? These are the small reasons that we lose our exam. And the problem with this exam is that we do not have any standard answer sheet with us. We do not have any, as you go into your medical college, your teachers teaches you, so you know that what answer they are looking for. But in this exam, it is all like what we are reading from leaflets and the guidelines. We really don't know what are they looking for. And probably we think that we have performed nicely, but somehow college has done something wrong with me. I couldn't clear the exam. But there's something wrong with your presentation. That's why I couldn't clear the exam. And these are the small, tiny points which make you fail or make you pass. A girl can think, oh, I have done that water bath pool, fantastic. I uttered every single word and I spoke almost for 2 minutes, and that examiner was looking at me. Examiner was looking at you because he was thinking that you have not noticed very basic thing, that she has been given diamorphine just half an hour ago. You have to wait for 1.5 hours. You are losing the patient safety point completely, applied clinical knowledge completely, so failing the task. Am I clear?
Yes.
Okay. So now when someone is need to leave the pool, that is again an important question. For obviously peeing, for passing stool, if reconium stain liquor, if we need to do the vaginal examination, if abnormal vitals, if progress of labor is not as expected, if we need to speed up with hormone drip, like obviously if we need to give oxytocin because there is no progress of labor as we were expecting, or for additional pain relief, if she wants diamorphine, if she wants pethidine, if she wants epidural, or sometime to deliver placenta. So these are the certain reasons where she may need to leave pool, right? This is very easy, I guess. Now, delayed clamping. This could be another question from your role player. in the task which came to me. Though my role player did not ask, but your role player can ask. Because delayed clamping, they do ask. So delayed clamping is possible if both fine. Means if mom and baby both are fine, delayed clamping is permitted. Okay. If water birth option taken for other than prescribed factors, that we know that low risk 37 to 42 weeks, we know that all those factors. If still she opt for water birth, then these are the certain point which you have to take care. Means a patient is not low risk, a patient is less than 37 weeks, a patient is more than 42 weeks, a patient has some medical condition, serious condition, surgical condition, still she is insisting for water birth. In that case, if you have explained her all the risks, in spite of that she says, no doctor, I have to go for water birth, then you will say, in that case we can suggest you to be in the water pool for the labor but deliver outside. Even if she says okay, even then you will offer this line that will make a clear plan of action. There would be MDT approach and well-informed decision by laboring mother. Means she would be aware of that clear plan of action. This you have to mention. If patient still insists, even after the negotiation, she says, no, I want to give a trial of water birth, then you will say, then we would suggest you to be in water pool for labor, but deliver outside. And even for that, we are going to make a clear plan of action. There would be involvement of expert team of healthcare professional like my pregnancy doctor, baby doctor, specialist midwife for this, and you will be informed about that plan of action. Clear, girls? Clear?
Yes, doctor. Yes.
So delayed clamping could be a question. Now, what she
Yes,
can
doctor.
what she can wear, that is very normal this thing. Like if she asks, it's not very important, but I have just wrote, so if even if anybody asks, you should be knowing it, that she can wear t-shirt, she can wear bikini top, even she can be naked, it's her choice. Midwife has to wear that personal protection equipments, like the special kind of gloves, that is the, I don't know how to pronounce it, I couldn't get any pronunciation for this, but I pronounce it like gauntlet, I think T would be silence, gloves and the plastic apron or standard gloves. Then washing hands and arms prior and after auscultation. That's the reason, because this is clearly given in guideline. So if this is given in guidelines, so I won't think that birthing partner would be allowed to be inside the water, because water can act as a source for spreading the infection, right? So this is, midwife should wear this or should wash hands and arms. And how you estimate blood loss, more than or less than 500 ml. There are only two criteria for estimated blood loss. Again, if it comes as in your exam, in labor ward prioritization, that she had estimated blood loss around 400 ml. Now you have no clue whether should I consider it as severe or not. If it is less than 500 ml, it is not of a concern. If it is more than 500 ml, then it is a concern. Or if your examiner asks, then you should know. And last but not the least, this is very important algorithm which is given in guideline. How will water birth emergency evacuation? So basically, what is the basic problem with water birth? Evacuation only. Leaving pool is the major difficulty. That is the challenging part, because when you come out of the water, you see in the water your body, you feel very light. But when you try to come out of water and when you try to take steps on pool step, don't you feel that your body is very heavy? Don't you? When we try to come out of pool and we just try to put our feet on that pool step, we feel our body is very heavy, right? So difficulty is always evacuation, leaving the pool, exit the pool. So this you can remember in case it comes as SD. The aim of this procedure is to remove the women from the pool in the quickest and the safest way possible. Do not initiate this procedure if woman is able to remove herself from some assistance. This is again very important point. If woman is lean, thin, mobile enough that she can move herself, please do not do anything unnecessary. So we always initiate this in case woman is not able to get out of pool herself. Then we do this water worth emergency evacuation, this procedure for the quickest and safest. You have to remember these two words, quickest and the safest way to remove women from the pool. Concern identified, anticipate and exit prior to collapse. Before excessive dehydration, patient collapse. Bleeding, patient collapse. BP high, patient collapse. Anaphylaxis, patient collapse. You have given oxytocin in her buttock, right? We do not do this sensitivity test for that. You have given in third stage of labor, she collapsed. She has anaphylaxis, she collapsed. So concern identified, anticipate, exit, and prior to collapse. Before she collapses, you should identify the concern, you should anticipate the problem, and you should plan for exit. Assess women's condition, call for midwifery and the medical assistance. Fill the pool with the tepid water to float women to surface using scoop net onto transfer trolley or bed. Simple. We will fill the pool with the tepid water. Women automatically will float. If she is drowning, she's immersed deep inside the pool. After filling pool with the tepid water, she will float. Once she will come to surface with the help of scoop net. You remember that scoop net that all Britishers used to for take it for fishery, for fish, collecting fish from pool and ponds. That is scoop net. You must have seen in Bollywood movie, they are sitting at the corner of the pond and with one stick, and there is one net. It's like basketball net, and they are just putting it inside and they're taking the fishes out. That is the scoop net. So fill the pool with the tepid water. Women will float. She'll come to surface using the scoop net and then transferring to the trolley. 4 to 6 people required. Pool with tepid water. Float women to surface, using scoop net, transferring to trolley. These are the 4 important points, and 4 to 6 people required. Take measures to stabilize the women condition, remove women from pool when safe to do so. This is them. Record all emergency procedure, women's note. Drill for dealing with emergency situations should be practiced as a part of routine. Prompt updates, attendance will be recorded. That way, skill and drill for emergency situation. So I would suggest that you memorize. You just take print out of this appendix. I am sure you girls might be taking print out of all algorithm. If you have not started, start doing from today itself. Take the printout of all algorithm, keep it in one folder. Whenever you want to revise, whenever you are looking for something, you can go through the algorithm for small for gestation age, for PPH, for VTE, for everything. They have a proper algorithm. So you just take the printout and put in a folder. So whenever you are trying to recall something, you can quickly go through that folder of algorithm. And in the end, in revision, that algorithm folder is very useful. So now from today onwards, you are going to make that folder. So first algorithm, you are going to put this one, because nowadays water birth is very, very, very common in UK. That's why the question related to water birth are so common. UK exam has a typical pattern. When they have more cases of syphilis, they ask syphilis. When they are having more water birth, they are asking water birth. Whatever situation is prevalent there in their country, they are focusing for that particular question and putting them as tasks, because for them it is for their training and they want to train them for their routine, epidemic and endemic. So they always pick up the task which is very commonly the problem they are facing. Third degree, fourth degree perineal tear, why it comes in every exam? Because this is the very, very common complication in UK with delivery, because they prefer home delivery, midwifery deliveries and normal deliveries. Am I clear? So this is all about water birth. There are 26 slides. Recording will be uploaded in the channel, and it is going to be there for 5 days. After that, we will remove it. Okay. Okay, girls.
Thank you, Dr. Pooja. Thank you, Dr. Pooja.
Okay.
Very nice.
Okay, just we will keep meeting this way. So now start practicing, girls, because I'm sure most of you will get the seats in FAB exam, because it's only online exam. Most of you will get the seat. Do not take this exam for granted. Do not waste even single day. Every single day matters a lot. Trust me on that. Still, you have 2 months in your hand. If you practice nicely, there is no reason that you will not pass the exam. There is no reason. At least I do not find any reason that you will not pass the exam. Okay. So good night, take care, and keep studying. Okay.